Now we'll discuss about the large nerves. So mainly in large nerves you'll have the medial nerve. The medial nerve will be on the medial side. If you remember, it will cross from the lateral side to the medial side, right? So that is the medial nerve. And you'll also have the ulnar nerve, which is also a large nerve. And you'll also have the radial nerve, which is also a large nerve. Now let us discuss about this large nerve. First, the medial nerve. The medial nerve is closely related to the brachial artery because it's crossing from the lateral side to the median side of the brachial artery. So it's closely related to the brachial artery throughout its course in the arm. So in this diagram you can clearly appreciate the brachial artery and medial nerve. So this red one is the brachial artery and this one is the medial nerve. You can see how it is coming from the lateral side to the medial side. So this is the median nerve. So it is throughout the course of the arm, it's in close relation to brachial artery. In the upper part, it is lateral to the artery, whereas in the middle of the arm, it crosses the artery from lateral to medial side and remains on the medial side of the artery right up to the elbow in the arm. So in the arm, the median nerve gives off a branch to pronator teres just above the elbow. So it gives a branch to pronator teres just above the elbow and vascular branches to the brachial artery. So remember, median nerve gives vascular branches to brachial artery and also to the pronator teres it gives a branch, and articular branch is also given to the elbow joint and arises at the elbow. So articular branch to elbow joint which arises at the elbow. So this is about median nerve, just nothing, only the important point is it is turning from the lateral side to medial side. It is in close relation to brachial artery, so it will give one branch to the brachial artery, that is vascular branch, and also it gives one branch to the pronator teres and also gives an articular branch to participate in the elbow joint. That's it. Now we'll talk about the ulnar artery. So ulnar artery, if you see, this is the posterior side of humerus, right? So ulnar artery runs on the medial side. So this is the medial side, it runs on the medial side of brachial artery up to the level of insertion of coracobrachialis. So up to insertion of coracobrachialis, it will run medially, okay, where it pierces the medial intermuscular septum and enters the posterior compartment of the arm. So this is how it has enters the posterior compartment of arm, and it is accompanied by superior ulnar collateral vessels. And at the elbow, it passes behind medial epicondyle, where it can be palpated with the finger. So this is a medial epicondyle. At the side of medial epicondyle, on the posterior side, you can palpate the ulnar nerve, right? So remember, ulnar nerve till coracobrachialis, it is in the anterior compartment only, but from the lower side of coracobrachialis insertion point, it will turn backwards and come to the posterior side and pass near to the medial epicondyle, so that you can palpate the ulnar nerve near the medial epicondyle. Next, coming to the radial nerve. Of course, radial nerve is always the posterior compartment nerve, but at the beginning of brachial artery, the radial nerve lies posterior to the artery. So even the radial nerve is first in the anterior compartment, but only in the some part. So soon the nerve leaves the artery by entering radial spiral groove on the back of the arm, where it is accompanied also by profunda brachii artery. Very important. The profunda brachii artery is also the posterior artery of the arm. So in the lower part of the arm, the nerve appears again on the front of the arm. So only up in the radial groove, it will, in the radial spiral groove it is present, but again the radial nerve turns and comes to the anterior side between brachialis and brachioradialis muscle. Brachialis muscle is medial in the anterior compartment to the radial nerve, and laterally it will have the extensor carpi radialis. So that's it about this large nerves. Next we'll start with the cubital fossa.